And welcome to the surgical hand scrub technique topic. By the end of this session, you should be able to understand the indications of the skill, perform an effective surgical hand scrub, and overcome the commonly missed areas during surgical hand scrub. Let's get started. So when is this particular skill indicated? Surgical hand scrubs are indicated to reduce the risk of patient getting an infection from surgery. They are very important to effectively kill potentially deadly germs on the hands and to also reduce bacterial count on hands. The equipment needed for a surgical hand scrub is antimicrobial soap and water. Prior to performing the hand scrub, expose the hands till the forearms, remove rings, wrist watches and bracelets before beginning surgical hand preparation. Ensure fingernails are clean, short, and artificial nails or nail products are not worn. And finally, if hands are visibly soiled, wash hands with plain soap before surgical hand scrub. The following are the steps to an effective surgical hand scrub. Firstly, rinse your hands with water. Take adequate antimicrobial soap. Next, scrub fingernails with sterile, disposable or autoclavable nail brushes. Then scrub each side of each finger between the fingers and the back and front of the hand for 2 minutes. Following that, scrub the arms, keeping the hand higher than the arms at all times. This helps to avoid recontamination of the hands by water from the elbows and prevent bacteria-laden soap and water from contaminating the hands. Wash each side of the arm from wrist to elbow for a minute. Repeat the process on the other arm and keeping hands above elbows at all times. Lastly, rinse hands and arms by passing them through the water in one direction only from fingertips to the elbow. Do not move the arm back and forth through the water. Proceed with the operating theatre holding hands above elbows. Ensure that surgical hand scrub is done properly to cover all areas that are commonly missed. These are fingertips, interdigital areas, and the thumb. The duration of the entire surgical scrub procedure should be done ideally between 3 to 5 minutes. The basic principle of scrub is to wash the hands thoroughly and then to wash hands from the clean area to a less clean area. The basic principle of the scrub is to wash the hands thoroughly and then to wash from a clean area to a less clean area. Extremely hot water is harder on the skin, dries the skin, and is too uncomfortable to wash with for the recommended amount of time. However, because cold water prevents soap from lathering properly, soil and germs may not be washed away. If the hand touches anything at any time, the scrub must be lengthened by a minute for the area that has been contaminated. If the hands and arms are grossly soiled, the scrub time should be lengthened. However, vigorous scrubbing that causes the skin to become abraded should be avoided. At all times during the scrub procedure, care should be taken not to splash water onto surgical attire. Once in the operating suite, hands and arms should be dried using a sterile towel and aseptic technique. We have come to the end of this session. Thank you.